Welcome to our Medvel Lyceum. The idea is that I'm hearing from a lot of you that you want to do a deeper dive into some topic of interest, and you want to meet other Medvelistas from around our little town. So we took a page out of Aristotle and have this all village gathering to talk about interesting topics. And what we'll do, as most of you know, is go for about 45 minutes with basically you listening in while I have a conversation with Maria and Dave. And then at the top of the hour, we'll go grab another cup of coffee. We'll open it up and just start having a conversation about what I think is such a topical topic, and that's healthcare workforce problems that we're having. And I'll tell you that in our club collaborations, this is the number one topic that's been going on for some months now, is how do you recruit? How do you retain? I can't find enough people. And we got quiet quitting. We got loud quitting. We have the mass resignation out there following the pandemic, and so we got some problems to deal with. And I'm so tickled that there is a shining light that we could look to, right, from Medvel. So Maria and Dave, I'll have you introduce yourselves quickly and talk about Full Circle Health because you've stepped up and done some wonderful solutions during some trying times that I think we can all learn from. What I'd like Dave and Maria for you to do is to introduce yourselves, and then also we have your boss, Dr. Epperly, on the screen too. So Ted, please chime in or help us to understand the good things that are going on at Full Circle Health. So, Dave and Maria, thanks for being here. And would you maybe quickly describe Full Circle Health? And then I'd like you to introduce yourselves a little more in depth.
Sure. So thanks everybody for having us. We're really proud to represent Full Circle Health at the Lyceum today. Our organization was started as Family Practice Residency of Idaho back in the early 70s. Over time, we transformed into a federally qualified health center. And when coupled with a residency program, that becomes a unique animal called a teaching health center. We have 10 clinics in 9 locations across Ada and Canyon counties. We have a very, very diverse patient population. And we find that our dual mission is one of the key drivers of our success in recruitment and retention. I'm Dave Murgoitio. I'm the Director of Human Resources. I've been with the organization for just over 15 years. And that experience has really been invaluable to me in the human resource role because I've walked in the shoes of many of our colleagues. And I find that improves my ability to connect with them on a personal level. Maria?
Good morning, Medvel community. I'm delighted to speak to you today about our recruitment and retention at Full Circle Health. Dave, as my HR partner, has been integral in helping with this. When I started at Full Circle Health as the VP of Nursing, or CNO, 4 years ago, our turnover rate for nursing, and this is prior to the pandemic starting, was 35%. So we have done so much for recruitment and retention in the last 4 years that we now have that turnover rate at less than 20% consistently. So there are some quarters, because I track that every quarter, Dave will say, you had 0% turnover, but let me double check that statistic. And then he'll get back to me and say, yes. So we want to talk to you a little bit today about our recruitment and our retention, kind of our recipe for success. And I think that really starts, like Dave said, with our mission to be that teaching health center where we're training those family medicine and pediatric physicians, as well as serving the vulnerable population of Idaho in a quality, affordable care. So happy to be talking with all of you today.
So tell us a little bit more about Full Circle Health, because that's a very substantial force in the Boise area where we're located. It's how many employees do you have, Maria? How many nurses are on your staff? How many clinics, revenue-wise? Because you've got a very sizable operation there.
Yeah, so we've grown tremendously over the last decade. When I started with the organization, we had 2 clinics and 135 employees. We now have the 10 different clinics, and we're approaching 500 employees. And as I said, we've got locations in downtown Boise, central Boise, Meridian, Kuna, Nampa, as well as Caldwell. And then we have a training presence for our residents in the Magic Valley area as well. From a revenue standpoint, we are approximately $56 million budget. Of course, the lion's share of that goes back to our people. So I've heard the quote, "Ladies and gentlemen, taking care of ladies and gentlemen," and that's kind of how we approach our human resources.
And you asked specifically about how many in nursing. That's a little bit over 100. So a big part of our 500 is nursing.
Dave, how many employees total?
So as of today, we're about 465 belly buttons.
Okay, counting belly button. All right. Well, Maria, you are a medalista. You're a member of our Transformers club, and so you know a lot about the audience here. But one of the things I wanted to ask the two of you is that I've been very impressed by, Maria, you come in as the lead nurse, the director of nursing service. You get promoted up to the vice president for population health. And as you try to put in some initiatives, I always worry about this with someone saying, okay, I need some help from HR. And sometimes we talk about HR with the same disgust that we talk about attorneys because so often they can say, well, here's what you can't do. We're all about compliance. And instead of figuring out a way to do that, they put up so many barriers. So, Maria, when we started talking about this Lyceum, you said, I'd like to bring in, I think you call him a partner. And so a lot of us have HR departments, HR directors. And could you tell us about that relationship? Because it seems to be pretty darn good. And Dave figured out some ways to do things instead of ways not to do things, right?
Absolutely. So Dave is an excellent partner to me, as well as all my other leaders here at Full Circle Health and our CEO, Dr. Epperly. So I think that's one of the things that attracts and retains our employees is our culture. It's a learning culture. And so when I go to Dave with my ideas and say, Dave, we need to put together a recruitment video, just like we have for the residents, but for employees. And we need to get our employees to tell the story about why they work here at Full Circle Health. He says, yes, let's do it. Let's make it happen. So as far as an HR partner, I bring ideas to Dave and he helps me make them a reality. So we very much give and take back and forth, have great dialogue, and come up with the best solutions to help us recruit new employees and, of course, retain them.
Dave, what makes you different than my view of so many HR departments? Do you have a different worldview? Have you had different jobs? Have you walked in other people's moccasins? Because the partnership the two of you have is extraordinary.
I don't necessarily know if I'm all that different. I think in a lot of ways, HR professionals are similar in that we want to support the organization's success. We want to support our individual employees' success. I think one of the reasons why I really enjoy Full Circle Health and working with partners like Maria is our shared values, our I care values, and our dual mission. And it's hard for me to say no to an idea that Maria brings when I know that it's going to either benefit our people or benefit our patients. And so I really work to get to a yes. Any HR professional is going to say, okay, well, there's some rules that we need to be mindful of. And there are great mentors for me that help me say, well, Dave, here's what could happen, the worst case scenario, but what's most likely to happen. So I don't know if I'm necessarily unique, but I bring a partnership mentality, and I lean on the strengths of my colleagues to bolster any kind of weaknesses or fear that I have, whether that's personal or professional concern. And we just try to get to a yes as much as possible.
Well, whatever you're doing appears to work. And so let's dive into some of that. So tell me a little bit about some innovations that you've done in the recruitment. We're going to be talking about retention pretty soon, but what are you doing that's giving you some leverage on the finding the employees part of this?
Jim, when we started talking about this concept in response to your invitation, we were saying it's not one thing. It's lots of little things that add up to our total package. And so that's where this concept of the recipe for success came from. So there are lots of different tactics that come together to kind of create our special sauce, if you will. And when we were talking about this, one of the primary drivers of the conversation was we have to understand what we do well, what we're serving, if you will, and we need to find people who have an appetite for what we're serving up. So whether that's our mission and our values, our culture, our recognition programs, the value proposition from our compensation and benefit packages, there's lots of pieces and parts that go into this. So we can talk more specifically about the different ingredients as needed, but it really isn't one thing that is like the antibiotic to your problem or the one solution. It's lots of different pieces.
Well, go ahead, Maria.
Oh, I was just going to say, just getting into some of the ingredients, I do think our mission, our organization's mission, is really why we connect with some of our employees. It's their why. It's what builds their appetite, what gives them a purpose to wake up in the morning and do something meaningful. So I really think that is one of the main ingredients. But it's also our culture of being that learning institution, the team, the collaborativeness. I know when I started here at Full Circle, prior to me, there was a director that would just hire all the nursing staff. Well, one of the first things I changed was team-based interviews. So I want an employee to come in, or a candidate to come into that interview to meet the team, not just meet one person. They're actually interviewing us just as much as we're interviewing them. And I can tell you that several of my managers on my team, when I ask them why they took the job, the first thing they will say, it's because I saw the team and I wanted to be part of it. I wanted to be part of what you do there at Full Circle Health. And so I think that is the team-based interviews are a must. And that's one ingredient.
Well, so could I double click on that, Maria? What is a team-based interview? What does that look like? Who's there? Do they decide? Do you decide? How does that work?
It's a team decision. So the staff will have coworkers. So if we're hiring a medical assistant, LPN or RN for a certain clinic, they will be interviewed by partners, by coworkers, as well as supervisor and management. And collectively, they will get to ask the team questions. The team will ask them questions. And then after that candidate leaves, we have scoring rubric, so to say. So do they meet the qualifications of the job they're applying for? Are they the right fit? Is this somebody we want on our team, and that somebody that's going to make us better, better for our community, better patient care, someone that's dedicated and has the same values? That's part of the interview process. Do they have values that align with our organization? And we collectively have that discussion and make a decision, and then partner with HR to make that job offer.
Do you find that that team helps with the retention then? It was kind of their decision, and they want that person to be successful so that they don't lose faith.
They have a stake in the game, right? I was part of hiring this person, and I'm gonna mentor them and give them the best onboarding experience so that they can get really good at their job, because that's going to help the team. It's going to raise the bar.
We saw a recruiting video, a beautiful recruiting video that was in the reminder and the flyer that went out. So when do you use that? When do they see that? And how did you do that? How much does it cost? Could we do that?
I'll take part of that question, and then I'll give it to Dave. That was our nurse manager's idea. And like I said, we do that to recruit residents. And so why not have a video to recruit employees? It's out there on our website. It is interviews with employees of Full Circle Health in different roles, really telling their story, why they came to work for us and why they stay with Full Circle Health. None of it was scripted. They are all speaking from their heart. And it is just such a unique and wonderful video to watch. And if candidates that are coming in for a job interview have not actually gone out to our website and seen the video, it's the first thing I'd play in an interview process. I'm like, watch this video, and listen to our employees about what it's like to work here at Full Circle Health. So we play, that is on our website, but we also, one of the creative things that we came up with was doing on-site hiring events. So we will partner with our HR colleagues, and we will go to a clinic and we will advertise that we're having a hiring event today. So people can walk in with no interview scheduled, get an interview with the team, and actually walk out with an offer, pending resource or references. But we play that video at those hiring events. So while they're sitting there waiting, because their interviews aren't scheduled, so sometimes people back up, they actually get to watch that video on a TV in the waiting room.
It seems to me that a lot of your employees are recruiting other employees. So you've got on-site recruiting events you mentioned. And then to tell us about the bonus for them bringing in candidates.
So we do have an incentive for current employees to refer family members, friends, or others. So we do financially incentivize people to do that. But we know that word of mouth advertising is very powerful. So if our current employees endorse working for Full Circle Health, that can be a really great recruiting tool for us. And so we really encourage that. Oftentimes they're like-minded individuals, they're mission aligned or have the same values. So we find that sometimes our employee referrals are really valuable to us.
That video is something that I think we ought to use the technology more for. Did you outsource that?
Yes, so
remember how much it cost? Is that something we should consider?
Yeah, so Jim, I don't remember exactly how much that cost. I think it was on the order of like 10,000, somewhere in there. But we did hire a firm to come in and help us with that. So it was professionally done. It wasn't, Dave in the back office snipping and clipping video clips together. So we did have some professional help on that. That was just outside of our personal skill set. But we were mindful of the folks that we included in the video. We wanted them to be eager to do that. We didn't want it to be scripted or fake. We really wanted it to be genuine.
Yeah. Neither of you or Dr. Epperly were in the video. So I was struck by that. It was all line workers.
Yeah, again, it's not so much a sales pitch. It's just an attestation, right? It's not a gimmick to come work here. You are going to find that this is a very genuine organization, a culture of caring and kindness. We live that mission every day. And so it's not a sales pitch from Dave in HR or Ted as the CEO, or even from Maria. We really wanted our frontline staff, whether it's reception, pharmacy, nursing, whomever, our community health workers, right? So it's a good broad swath of our people.
Mm-hmm. Well, our industry is struggling to find good people on the recruiting end of that. It looks like you're building your own. You, for example, have an apprenticeship program. Can you tell us about that approach?
So the apprenticeship program is for existing employees mostly, although we would take a new candidate who want to go on and continue education. So we help connect them with one of the schools. Primarily in my world, I'm dealing with nursing. So these are medical assistants, and we'll connect them and help them get Idaho launch funding, help support the cost of continuing education. And so they may work as a receptionist in one of our clinics while they're going to school to become a medical assistant. And then they take their exam and they do all their preceptorship hours with Full Circle Health in our clinics, and then take on a position, move from reception to medical assisting. And that's been pretty successful. We're kind of new in that. That's one of our newer strategies. And we've had 3 apprentices thus far go through that program.
Mm-hmm. You're very mission driven. You're dealing with a lot of our area's vulnerable population. Is that a plus or a negative in recruiting?
I think it's a huge win for us. We have to do a bit of a self-reflection on what makes us unique. And a big component of what makes us unique is the patients that we serve and the dual mission that we execute on every day. And so when we recruit people who have a similar interest, similar values, that is a big win, because we know that these people are going to be in it for the long haul. They're not chasing a paycheck, and they're not going to go chase down the next shiny thing that gets dangled in front of them, because it is a very competitive market. So a big component of our value proposition for our employees is the intrinsic reward that they get from the work that they do every day, whether that's serving a very diverse refugee population or a vulnerable HIV population, or just those in our community that are underinsured or have no insurance, or whether it's helping support the residents and fellows in their medical training. So we lean heavily on that when we post jobs. We lean on that when we speak with people about their interest in the position and why they want to join our team. So it's instrumental.
I'd love to give an example of that, the why people work here. So as the pandemic ramped up and COVID and the vaccines came out, and we had to do mass immunization clinics in the evenings and on weekends, I had more employees in this organization volunteer to help with those pop-up clinics, whether it was mobile, taking the mobile van down to the homeless shelter, or coming in on a Sunday morning to vaccinate our patients. We had more people sign up to work those clinics than we actually could use. So I was turning our employees down who wanted to help the community. So that's how strongly our employees are connected to our purpose.
Mm-hmm. You have a way to explain this in your I Care soundbite. And you know, how brilliant to get that into 4 letters that create a word. Tell us about that.
We've had I Care values in our organization for quite some time. I had heard from someone special that they had come up with I Care values in around 2001, and it was subsequently stolen by the other local health systems. So we've had it for a long time, and it has been adopted by lots of people because it just resonates in healthcare, right? So our eye care values stand for integrity, compassion, accountability, respect, and excellence. And so we think about that in terms of how we treat our patients and educate our learners, but also how we treat each other as colleagues.
Do you think that most of your employees could repeat that?
I would say a lot of them can, and in the event that they can't, little badge buddies to help them remember, right? This is how we operate.
As we do annual performance reviews, that is something our leaders talk to our employees about. And so it's an expectation that you live up to those values and you behave according to those values if you're going to work at Full Circle Health.
Yeah. We've got about 15 minutes left before we open this up into a group discussion. And so the audience right now, you're going to be participating here pretty darn soon. Think about things that you want to add. Is there something going on at your institution that is worthy of us considering? You have some other questions of our guests. So we'll be doing that, but I do want to talk about retention. You're recruiting well. What are you doing to keep the people around? Any innovations there that seem to be giving you some leverage?
I think one of the important things that we do is we practice something called leadership rounding. So everybody from our CEO, Dr. Epperly, every leader in the organization, every month is assigned to round on our employees at a particular site. That leadership rounding includes a topic every month. So all of our leaders are on the same page. We're all out there educating, talking, having conversations with our employees about the theme of the month. But also what's important is we listen. So when our leaders round, they're out there listening to our employees, listening to them tell us what's working well, what do we need to do more of, where are their pain points, what obstacles, what's getting in the way of them providing high quality care to our patients. And we not only listen to them, we follow up and we give them feedback and we act on their feedback. So leadership rounding is really one of our key things to build trust with our employees, show them our values, that we respect their opinion, empowering them to help come up with solutions, and be part of that process, to that learning process, that evolution, to just make our whole system better. So that's one of the key things we do.
Well, didn't one of your employees, after their training, they don't do the EMR training in the first week? Wait, how did that come to?
Yeah, so we have a really robust onboarding process for employees. I believe, and I think Dave believes, everybody wakes up in the morning, wants to come to work and do a good job, right? Nobody wants to come to work to fail. They want to do a good job. It's our job to tell them what a good job looks like. So having really accurate job descriptions and expectations laid out so that they know how they can meet our expectations. Working in the EMR is just a fact of healthcare today, right? So they have to be good at working in the EHR. We used to do that training on the third day of orientation, and we listened to our employees tell us, boy, that's really overwhelming. It's a lot to learn in 3 days of orientation. So we decided to change it up, and we now don't send our new nursing staff members to EHR training until their third week. So after they've been on the job for 2 weeks, they've seen it on the floor, they've watched it, they're writing down their questions that they can bring to training. And the feedback has been that was very advantageous. Our newer employees are learning more, understanding it better, because we're waiting till that third week instead of throwing it at them on the third day.
Mm-hmm. Yeah, well, and then you do state interviews. Tell us about that.
So we do exit interviews as well as stay interviews. And quite frankly, we could probably do more stay interviews. But oftentimes what we do is sit down with people who are just rock stars, or even people who may have some concerns that we know are bubbling up through either nursing leadership or HR. And we try to unpack those, right? So one purpose of a stay interview is, tell me why you're still here. Tell me why you continue to work for us after all this time. We have an employee who's been here for 40 years. So we really have unpacked that with her of what is special about this place and why have you been here so long? And so that same concept can be applied to lots of people.
Mhm.
If someone is having some difficulty, we could do a bit of a stay interview as well to say, I'm not going to come out right out and say, hey, you're an important employee to us, and I think you're about to quit. But I can say, hey, it's been a little while since I've spoken with you. Let's have a conversation. How are you doing? Why did you come here? What things keep you engaged? And so through that positive conversation, I may learn some challenges or negative things, and then we can head those off early until it gets so bad that the person walks away. So in medicine, it's the same thing as ounce of prevention is worth a pound of cure. If I anticipate that we're going to have trouble with the person, we may want to have a stay interview with them to really kind of explore what's happening.
Well, if someone leaves, that can cost you up to an annual salary of that person when you add in all the direct and indirect costs. And so that's a pretty good investment to do a stay interview and save yourself $80,000. Maria,
Yes.
you were going to say something, I think.
Well, I was just gonna speak to the stay interviews. We also have a process here at Full Circle Health where we do quarterly check-ins. So a lot of our supervisors and managers will use those same questions in a stay interview when we're meeting with our employees for a quarterly check-in. So our HR partners track that. So they know that every employee has or has not been met with that quarter because we use an electronic system. And part of that quarterly check-in is setting goals. So what are your goals for the next 3 months? How did you do on your goals the last 3 months? And then we always ask our employees, what are you most proud of? What do you want to brag about today? What do you want your supervisor, your manager, your VP to know about you and what you accomplished? And again, that goes back to our mission and why we're here, because you will usually hear when our employees talk about what they're proud of, it's something related to either learning or patient care, right? So that keeps them engaged, and we use those stay interview questions a lot during those quarterly check-ins.
You talk about your transparent pay policy. Really? It's transparent? Are you crazy or something? Wouldn't that create problems?
So to be transparent, we're not totally there yet. If you have not heard calls of pay transparency from your HR professional, you certainly will. This is a growing practice or growing trend in the labor market, calls for pay transparency. So we want to take a very equitable approach. We got to be competitive to recruit, but also to retain people. But we know that we are not leading the market in terms of compensation. So we are structured in our compensation practices. We're equitable in our compensation practices. And then we do our best to keep up within budget. But we do lean on other components of our total compensation package to, bolster that value proposition. So I would encourage you to be working with your HR departments around pay transparency and pay equity, because if staff find out that it's not a fair game, all the other ingredients and efforts that you have put into place will be for nothing.
What does pay transparency look like in reality?
It's going to depend on the organization. So some organizations will post all the different salary ranges for the various roles. They could have transparency on the sources of data where they're benchmarking salaries. So it really can look different by each organization. And so you may ask that question of your respective HR departments and then start to assess what degree of transparency is appropriate for our organization at that specific time, because you may choose to evolve your pay transparency practices over time.
Okay, well, thank you, Dave. So back to this idea of building your own. You're doing some training for like MAs, but looks like you're doing some leadership training too. As you take your good employees and promote them into leadership. Tell us about that.
Sure. So we recognized that as a growing organization, we had a pretty narrow group of leaders at the top of the org chart, and we have added a number of clinics over the last few years. So with that growth, we recognize that we need more managers, we need more frontline supervisors. And so we had a real weakness, so to speak, in terms of our leadership and our leadership development program. So we developed a 4-part boot camp that includes Maria, myself, our Chief Operating Officer, and our Director of Pharmacy. We've also included our Director of Rev Cycle. And we have each of these people talk about a component of leadership. So it's not just the same person talking the entire time. We have lots of different leaders. And we try to keep those groups small. One of our leaders calls it a pizza meeting. So if you have too many people to share one piece of, one large pizza, then you may have too many people in the room. So keeping it small creates a sense of intimacy, and people are more likely to share situations or ask questions. So each session is about an hour long. We then come back and bolster that boot camp with sound bites on specific topics. So this week we have one on performance reviews, or those quarterly check-ins, and how to have those conversations. We'll have similar trainings on workers' compensation issues, FMLA and intermittent FMLA issues, other items like ADA, Americans with Disabilities Act. So some of these are very HR specific things that we want our supervisors to be aware of, but then they could also be on performance management, motivation, how to give appropriate recognition. So there's lots of different topics that we'll discuss through that training program.
So if you can't measure it, you can't manage it. You seem to be doing a pretty good job with metrics. What are you watching? How does that inform your processes?
Sure. So one of the easiest things to track is employee turnover. So I would venture to guess that each of your organizations is tracking turnover. We do the same. We have a fair amount of internal mobility, and so I don't track that specifically or separately from turnover. But when we calculate turnover, it's those people leaving the organization. The other areas of measurement are for our human resources dashboard. So the human resource department reports up to our board of directors through our HR and compliance committee. And at each meeting, we review our human resources dashboard. That measures things like the demographic of our population, the age, the ethnic makeup of our population. We'll look at years of tenure. We will look at quarterly check-in completion rates. How much PTO and time off do people have? So there's lots of different ways that we're looking and measuring our success. You want to add to that?
So Jim, as well as the system having that kind of a scorecard, for my nursing department, I'm a very strong proponent of balanced scorecards. So we actually have a scorecard, and we call them pillars. So we have 5 pillars. They are people, quality, finance, service, and growth. And so we have key performance indicators, metrics under each of those pillars. And every year, my nursing leaders get together and come up with a list of strategies on how we're going to improve those key performance indicators. And the first time I did that with my team, and they saw that finance was something that nursing was going to work on, I got some pretty big wide eyes, like how can nursing impact finance? But our key performance indicators are, what are we paying in overtime? Because that's one of our largest costs, our people, our pay. So every year we try to work on decreasing our overtime hours, so right staffing. We also found a way to track our nursing cost per visit, and that's on our scorecard. So, and then the other pillar that I'd like to mention is growth, and that's all about, like we're talking about growing leaders, and we do leadership boot camp. We also help our employees grow and reach their growth, their goals. And so we do monthly lunch and learns on topics that they suggest to us, that they bring forward. So every month we do lunch and learns. They can eat their lunch and log on and learn something that's pertinent to their job or something that they're interested in. So we track on my nursing scorecard how many lunch and learns we do every year. How many opportunities did we give our employees to learn and grow?
Mm-hmm.
So
in the last couple of minutes, Maria and Dave, any quick thoughts that seem to have worked for you that you'd like to leave us with?
I think from my perspective, and I can tell you why I continue to work at Full Circle Health. Again, it goes back to kind of what we started our talk with. It's our mission, it's our vision, our values, and our culture of being a learning institution, collaboration, and it starts at the top. And I'm not just saying that because my boss is on this call, but it starts with our CEO, Dr. Epperly. He trusts me to know my job and to execute. He doesn't micromanage me. If I do something wrong, we learn from it. He rewards me very well with accolades when I do a good job. And I have a purpose. I come to work every morning knowing that I'm going to impact the lives of my employees and our community with what I do. So that purpose, that mission, I think is really important.
Thanks, Maria. Dave, any quick summary?
No, I to some extent, I want to echo what Maria is saying. Your culture starts at the top, and leadership development starts at the top. Leadership development is a leadership issue supported by human resources. It's not an HR job. It's all of the leaders' job. And so that leadership sets culture. That often then directs the budget, the recruiting budget, the compensation, pay transparency. So a lot of things are influenced by leadership. So if you're the leader in your organization, you should be taking stock of how you are leading the team, the message you're sending, because it really does have a trickle-down effect. And in a lot of ways, to use the analogy of a recipe for success, the CEO is almost the chef and deciding what are we serving, how are we going to serve it. So there's lots of levers to pull or ingredients to include in your recipe. I think you got to take stock of what you have in the pantry, so to speak, and then run with what makes you unique. As we started in talking about this recipes for success, it's your employees have to be hungry for what you're serving. And if they don't have an appetite for what your restaurant serves, they're not going to come back. They're not going to stay. So hiring the right people who have mission fit, they're value aligned, that's going to be critical to your success from a staffing standpoint. So that's my perspective, at least.
Great. Okay. And with that, we'll stop the recording and open this up for some group conversations.